20 things you need to know about novel coronavirus. Number 1. What is the novel coronavirus 2019 NCOV? The 2019 novel coronavirus, temporarily named 2019 NCOV, was identified in China at the end of 2019 and is a new strain of coronavirus that has not been previously identified in humans. Number 2. Where do coronaviruses come from? Coronaviruses are viruses that circulate among animals, but some of them are also known to affect humans. After they have infected animals, they can eventually be transmitted to humans. A wide range of animals is known to be the source of coronaviruses. For instance, the Middle East respiratory syndrome coronavirus (MERS-CoV) originated from camels, and the severe acute respiratory syndrome (SARS) originated from civet cats. Number 3. Is this virus comparable to SARS or to the seasonal flu? The novel coronavirus detected in China is genetically closely related to the 2003 SARS virus and appears to have similar characteristics, although there is still limited data available on this virus. SARS emerged at the end of 2002 in China, and more than 8,000 SARS cases were reported by 33 countries over a period of 8 months. At the time, 1 in 10 people who contracted SARS died. The current 2019 NCOV outbreak caused around 10,000 reported cases in China during the first month of the outbreak, with additional cases subsequently being detected in Europe and other countries. See current situation update. At this point, there is too little data available to say for sure how deadly 2019 NCOV is, but preliminary findings indicate that it is less fatal than SARS coronavirus. While both 2019 NCOV and influenza viruses are transmitted from person to person and may cause similar symptoms, the two viruses are very different and consequently do not behave in the same way. It is still very early to draw conclusions on how 2019 NCOV spreads, but preliminary information indicates that 2019 NCOV is as transmissible in the same way as SARS and some other pandemic influenza strains have been. ECDC estimates that each year up to 40,000 people in the UK, Norway, Iceland and Liechtenstein die prematurely due to causes associated with influenza. Number 4. How severe is 2019 NCOV infection? At this point, there is too little data available to say with certainty how severe 2019 NCOV is, but preliminary findings indicate that it is less fatal than SARS coronavirus. Number 5. What is the mode of transmission? How easily does it spread? While animals are the source of the virus, this virus is now spreading from one person to another, human-to-human transmission. There is currently not enough epidemiological information to determine how easily and sustainably this virus spreads between people. The virus seems to be transmitted mainly via respiratory droplets that people sneeze, cough, or exhale. The incubation period for 2019 NCOV, i.e. the time between exposure to the virus and onset of symptoms, is currently estimated at between 2 and 14 days. At this stage, we know that the virus can be transmitted as soon as those infected show flu-like symptoms. However, there are still uncertainties as to whether mild or asymptomatic cases can transmit the virus. If people with 2019 NCOV are tested and diagnosed in a timely manner and rigorous infection control measures are applied, the likelihood of sustained human-to-human transmission in community settings is low. Systematic implementation of infection prevention and control measures were effective in controlling SARS and MERS coronaviruses. Number 6. What are the symptoms of 2019 NCOV? From what we know so far, the virus can cause mild, flu-like symptoms such as fever, cough, difficulty breathing, pain in the muscles, and tiredness. More serious cases develop severe pneumonia, acute respiratory distress syndrome, sepsis and septic shock that can lead to the death of the patient. People with existing chronic conditions seem to be more vulnerable to severe illness. Number 7. Are some people more at risk than others? Generally, young children, elderly people and those with underlying conditions, e.g. hypertension, heart disorders, diabetes, liver disorders, and respiratory disease, are expected to be more at risk of developing severe symptoms. As this is an emerging disease and there is only limited data available, we do not yet know which groups of people might be prone to a more severe outcome following infection with 2019 NCOV. Number 8. Is there a treatment for the disease caused by 2019 NCOV? There is no specific treatment for this disease, so the approach used to treat patients with coronavirus-related infections is to treat the clinical symptoms, e.g. fever. Supportive care, e.g. supportive therapy and monitoring, oxygen therapy, fluid management and antivirals, can be highly effective for those infected. Number 9. When should I be tested for 2019 NCOV? If you have an acute respiratory infection, sudden onset of either a cough, and/or a sore throat, and/or shortness of breath, and in the 14 days before the start of your symptoms, you were either in close contact with a confirmed or probable case of 2019 NCOV infection, or traveled to an area where there is ongoing community transmission of 2019 NCOV. Or if you worked in or attended a healthcare facility where patients with 2019 NCOV infections were being treated, you should contact your doctor by phone for advice. Number 10. Where can I get tested? If your doctor believes there is a need for a laboratory test for 2019 NCOV, he/she will inform you of the procedure to follow and advise which laboratory can perform the test. Number 11. How can I avoid getting infected? When visiting areas with presumed ongoing community transmission of coronavirus, you should do the following. Avoid contact with sick people, in particular those with a cough. Avoid visiting markets and places where live or dead animals are handled. Follow general rules governing hand hygiene and food hygiene. Wash your hands with soap and water, or use an alcohol-based disinfectant solution before eating, after using the toilet and after any contact with animals. Avoid contact with animals, their excretions or droppings. Wherever you travel, apply general rules governing hand and food hygiene. Number 12. What should I do if I have had close contact with someone who has 2019 NCOV? Notify public health authorities in your area who will provide guidance on further steps to take. If you develop any symptoms, it is important that you call your healthcare provider for advice, mentioning that you have been visiting an area of presumed ongoing community transmission of 2019 NCOV. Number 13. What are the rules for infection? Hand washing. Hand washing and disinfection is the key to preventing infection. You should wash your hands often and thoroughly with soap and water for at least 20 seconds. If soap and water are not available, you can also use alcohol-based hand sanitizer with at least 60% alcohol. The virus enters your body via your eyes, nose and mouth, so avoid touching them with unwashed hands. Number 14. Are face masks effective in protecting against 2019 NCOV? Face masks help prevent further spread of infection from those who are sick to others around them. However, face masks do not seem to be as effective in protecting those who are not infected. Number 15. Is there a vaccine against 2019 NCOV? There are currently no vaccines against coronaviruses, including 2019 NCOV. This is why it is very important to prevent infection or contain further spread of an infection. The development of vaccines takes time. Several pharmaceutical companies are working on vaccine candidates. It will, however, take months before any vaccine can be widely used, as it needs to undergo extensive testing to determine its safety and efficacy. Number 16. Am I protected against 2019 NCOV if I had the influenza vaccine this year? Influenza and 2019 NCOV are two very different viruses, and the seasonal influenza vaccine would not protect against disease caused by 2019 NCOV. However, influenza season is still underway. The influenza vaccine is the best available protection against seasonal influenza, and it is not too late to get vaccinated. Number 18. What should I be most cautious of when traveling abroad, including trips to China? When visiting China, you should do the following. Avoid contact with sick people, in particular those with a cough. Avoid visiting markets and places where live or dead animals are handled. Follow general rules concerning hand hygiene and food hygiene. Wash your hands with soap and water, or use an alcohol-based disinfectant solution before eating, after using the toilet and after any contact with animals. Avoid contact with animals, their excretions or droppings. Wherever you travel, you should apply general hand hygiene and food hygiene rules. Number 19. What if I have recently been to China and have become ill? If you have been to China and within 14 days of your return you feel sick or have a fever, cough, or experience shortness of breath, you should do the following. Seek immediate medical attention. Before you go to a doctor's office or emergency room, call them and tell them about your recent travel and your symptoms. Avoid contact with others. Ensure you do not travel while sick. Cover your mouth and nose with a tissue or your sleeve, not your hands, when coughing or sneezing. If you have easy access to surgical face masks, use one, and dispose of it safely after use. Remember to wash your hands after disposing of a mask. Follow appropriate disinfection, hand washing rules to avoid spreading the virus to others. Number 20. What about contact with pets and other animals? Current research links 2019 NCOV to certain types of bat, but does not exclude the involvement of other animals. Several types of coronaviruses can infect animals and be transmitted to other animals and people. There is no evidence that companion animals, e.g. dogs or cats, pose a greater risk of infection than humans. As a general precaution, observe basic principles of hygiene when in contact with animals.